Bismillahir Rahmanir Rahim. This is the first lecture of thyroiditis. Thyroiditis is a swelling or inflammation of the thyroid gland. Thyroiditis causes either unusually high or low levels of thyroid hormones in the blood. Thyroiditis represents a group of conditions that cause inflammation of the thyroid gland. In most types of thyroiditis, there are three phases including. The first phase is thyrotoxic phase. During this phase, the thyroid gland is inflamed and releases too many hormones, causing temporary thyrotoxicosis. We are seeing here many cases of thyrotoxicosis. The second phase is hypothyroid phase. Following the excessive release of thyroid hormones in the blood for a few weeks or months, the thyroid gland won't have enough thyroid hormones to release. This leads to a lack of thyroid hormones. This case called hypothyroidism. We are seeing here many cases of hypothyroidism. The third phase is euthyroid phase. During the euthyroid phase, the thyroid hormone levels are normal. This phase may come temporarily after thyrotoxic phase before going to the hypothyroid phase, or it may come at the end after the thyroid gland has recovered from the inflammation and can maintain normal hormone levels. I will talk now about types of thyroiditis. The first type of thyroiditis is Hashimoto's thyroiditis. This autoimmune condition, also called chronic lymphocytic thyroiditis. Hashimoto's caused by anti-thyroid antibodies. We are seeing here three cases of Hashimoto's thyroiditis. Hashimoto's thyroiditis is the most common form of thyroiditis and the most common cause of hypothyroidism. Hypothyroidism is permanent but can be treated. We are seeing here three cases of Hashimoto's thyroiditis. Hashimoto's thyroiditis begins between the age 30 and 50 years old and much more common in women than men. Hashimoto's thyroiditis affects about 1 to 2% people in the USA. The second type of thyroiditis is silent or painless thyroiditis. This is an autoimmune condition caused by anti-thyroid antibodies that attack the thyroid gland or an autoimmune disorder. Here we are seeing case of silent or painless thyroiditis. The symptoms of silent or painless thyroiditis are those of hyperthyroidism, followed by hypothyroidism. Symptoms improve within 12 to 18 months. Hypothyroidism may be permanent but can be treated. We are seeing here many cases of silent thyroiditis. The third type of thyroiditis is postpartum thyroiditis. This is an autoimmune condition caused by antithyroid antibodies that can occur within 1 year after giving birth. Postpartum thyroiditis is relatively rare. We are seeing here cases of postpartum thyroiditis. The symptoms of postpartum thyroiditis is hyperthyroidism appear 1 to 3 months after delivery. Symptoms of hypothyroidism begin about 4 to 8 months after delivery. Symptoms improve within 12 to 18 months. Hypothyroidism may be permanent but can be treated. We are seeing here cases of postpartum thyroiditis. The fourth type of thyroiditis is radiation-induced thyroiditis. This is a condition caused by radiation therapy used as a medical treatment for certain cancers or by radioactive iodine used to treat hyperthyroidism. We are seeing here cases of radiation-induced thyroiditis. The symptoms of radiation-induced thyroiditis are those of hypothyroidism. Hyperthyroidism may get better but then come back. Hypothyroidism often is permanent but can be treated. We are seeing here cases of radiation-induced thyroiditis. The fifth type of thyroiditis is subacute thyroiditis or the Quervan thyroiditis. This is an often painful condition thought to be caused by a virus. Subacute thyroiditis usually preceded by upper respiratory infections. We are seeing here cases of subacute thyroiditis or the Quervan thyroiditis. Symptoms of subacute thyroiditis include pain in the thyroid gland and those of hyperthyroidism, followed by hypothyroidism. Symptoms improve within a few months. Hypothyroidism is rarely permanent but can be treated. We are seeing here cases of subacute thyroiditis. The sixth type of thyroiditis is acute infectious thyroiditis. This is a rare condition caused by an infectious organism or bacterium. The symptoms in this case include pain in the thyroid gland and loss of hypothyroidism. Symptoms improve after treatment of the infectious cause. We are seeing here many cases of acute infectious thyroiditis. The seventh type of thyroiditis is drug-induced thyroiditis. This is a condition caused by the use of medications such as amiodarone, interferons, lithium, and cytokinase. Drug-induced thyroiditis only occur in a small fraction of people using these drugs. Symptoms in this case are those of hyperthyroidism or hypothyroidism. Symptoms continue as long as the drug is taken. We are seeing here case of thyroiditis from take the lithium drug. But here we are seeing here case of thyroiditis from take amiodarone. The eighth type of thyroiditis is radial thyroiditis. This is a rare disease caused by chronic inflammation and fibrosis of the thyroid gland. Fibrosis is the thickening or scarring of tissue. We are seeing here many cases of radial thyroiditis. The question now, how does thyroiditis affect? Thyroiditis can affect anyone, but it more commonly affects people assigned female at birth, especially adults. Hashimoto's thyroiditis is 4 to 10 times more common in people assigned female at birth than in people assigned male at birth. Thyroiditis most often develops in people assigned female at birth between the age of 30 to 50 years old. Silent or painless thyroiditis is also common in people assigned female at birth and is the next common cause of thyroiditis after Hashimoto's thyroiditis. The question now, how common is thyroiditis? The most common from thyroiditis is Hashimoto's thyroiditis, which affects approximately 1 to 2% of people in the USA. The other types of thyroiditis are rare. The question now, is thyroiditis life-threatening? Thyroiditis generally isn't life-threatening. However, a life-threatening condition called thyroid storm can develop if the patient have long-term untreated or undertreated hyperthyroidism, which can develop from thyroiditis. in the end of this lecture. Thank you for all